We are going to shift gears as we address another important topic in Northern Kentucky, and that is our health status. And we are joined by three health professionals today who are aware of our community's situation and our status. So we are going to discuss why good health is important to community vibrancy. And joining us today, and you can all just make your way up here to the table, we've got Dr. Michael Gieske. Is that correct, Gieske? All right. Take that, do that. He's the director of lung cancer screening and medical director of virtual health, the Virtual Health Center for St. Elizabeth. We've got Roseanne Niels.
Yes.
Vice President of Planning and Government Relations at St. Elizabeth, and Robin Feltner, Public Information Officer at the Northern Kentucky Health Department. So thanks to all three of you for being there. We have pretty significant news in recent days out of Dayton, Kentucky, where the City Council voted in favor of a smoke-free ordinance, which changed the game there. Most people seem to be happy about it. Some people were not happy about that. So, Dr. Gieske, can you just share with us why people in your line of work see this as something that's important to Northern Kentucky and how a smoking-related ordinance like the one adopted in Dayton can make a difference?
Yeah, sure, absolutely. I've been in family practice for 35 years now, and I've seen a lot of lung cancer. I've seen a lot of tobacco-related disease, and I'm primarily responsible for running our lung cancer screening program, which is a screening program for cancer. Equally as important is prevention when it comes to preventing lung cancer and tobacco-related diseases. And it's not just smoking, it's secondhand smoke as well. Secondhand smoke, just like smoking itself, can cause not only lung cancer, it can cause esophageal, stomach, liver, colon cancer. It can cause kidney, bladder cancer, and cervical cancer as well. It contributes to sudden infant death syndrome. It exacerbates asthma in children. And it really contributes a lot to the healthcare costs of our community and our state. And so as an extension of my lung cancer screening job, I've also gotten involved in tobacco-related prevention and cessation, and this was a natural extension of that. And it was really exciting to be a part of this. I made 2 trips down to Dayton, Kentucky. We presented a slideshow one night, and then this last time we had a brief 2-minute presentation to give each of us. And it was very interesting to see how it went. It was a close vote. It was 3-2. So we were very pleased that it went that way. And we consider this will be a catalyst for other cities in the region to fall into place as well.
And Roseanne, your thoughts?
Yes, okay. St. Elizabeth's Healthcare's vision is to help Northern Kentucky be in Southern Indiana to be the healthiest community in the nation. So smoking is, as Dr. Gieske said, and smoking rates are directly related to some of the biggest chronic diseases that are available, cancer, heart disease, stroke. And just by changing our smoking rates, we can achieve some of that vision you talked about earlier of being a vibrant, healthy community. Dayton, we do applaud, and we were so excited to have them pass this ordinance because it is the first step for Northern Kentucky in this direction. They were courageous in passing it to be one of the healthiest, hopefully, cities in Northern Kentucky. So we hope, and we will work very hard to continue that momentum throughout the rest of Northern Kentucky.
And Robin, the health district played a role in this as well. So share with the audience the perspective of the Dayton ordinance and smoking related legislation and issues in Northern Kentucky from the health department perspective.
Absolutely. Well, congratulations and thank you to the city of Dayton on the passage of the comprehensive smoke-free ordinance. Over and over again, we have seen smoke-free policies just proven to be good for health and good for business as well. Smoke-free policies are the most effective tool that we have in our toolbox to reduce secondhand exposure, especially to workers. And these types of policies have also helped people to stop smoking and prevent youth from smoking in the first place. And Kentucky is spending close to $2 billion a year, with $2 billion a year on healthcare associated costs due to smoking, and it's completely preventable, absolutely preventable. And I grew up in Kentucky and in Highland Heights and Fort Thomas, and I know we are a proud people. And I know Kentucky wants to do better. Adults and youth and even pregnant women are some of the highest smoking rates in the nation. So I know as Kentuckians, we want to do better. And the way that we can do that and protect secondhand smoke is to implement these policies and these ordinances. So it's a big win for Northern Kentucky, and it's a big win for Dayton. We were very excited.
And Dr. Giesky, it's not just smoking and the related illnesses that hurt Northern Kentucky. What are some of the other health issues that this region faces perhaps more than average?
One of the things we have to deal with that's kind of along the lines of lung cancer is radon. And whenever I give a presentation on lung cancer prevention screening, I try to talk about radon now. Smoking causes about 80% of lung cancer. There's 20% that's not related to smoking, and the second leading cause of lung cancer is radon. So that's something that we need to address. Kentucky.gov has a free site for getting radon kits. You can contact the CDC. You can get one at your local hardware store. And we should all test our homes for radon. If it's above 4.1 picocuries per liter, you should have mitigation. There's a lot of folks that I deal with. I got into patient advocacy last year that have lung cancer that got lung cancer outside of the guidelines that we presently screen for. And a lot of these are young females, and a lot of these cases are due to radon. An interesting thing happened in the history of cancer. If you look at all cancer mortality in the 1950s, 60s, 70s, and 80s, the higher socioeconomic classes, the rich folks, had a much higher rate of cancer than the lower socioeconomic class. And what happened with time, and the reason for that, to address your question, Michael, is that the rich folks had some bad habits. They were heavy, they smoked, they drank, they didn't eat good foods, they didn't exercise. And what happened over time is that the lower socioeconomic folks, they got smarter, and they started picking up some of the bad habits, I should say, of the higher socioeconomic class. And the higher socioeconomic class started getting smarter. And in 1988, these two lines crossed. There was no healthcare disparity when it comes to cancer mortality. Around that same time, screening kicked in, and that made a dramatic difference. And then we started to see the cancer rates fall, and they are continuing to fall. But unfortunately, the lower socioeconomic class is now below the upper socioeconomic class. We need to work on closing that gap again.
And Roseanne, outside of the problems we face, we did hear Dr. Salzman reference parks moments ago. They're important to communities, right? And so having access to robust recreation opportunities and fitness opportunities, those can play a role in combating people ever starting to go down the path of bad health choices.
That's correct. Definitely activity and healthy behaviors, healthy eating, all weigh into health outcomes and health status. So we definitely have a lot of education and prevention opportunities. Screenings probably fall into that category, but encouraging people to move, just to move and get out and take advantage of the parks that are going to be here in 2030, right? And the bike trail that's going to go all the way down the river. So definitely have that. And it's part of our community health needs assessment. Every 3 years we do an assessment and identified healthy behaviors as one of the issues or problems, as well as a big factor of health status, social determinants of health. And that's a newer term around housing, transportation, food, some of the topics we've talked about. They have an impact on health outcomes. And so we're working to partner with community agencies, people that are experts in these fields, to try to address those so we can improve the health of our community.
And Robin, the health department focuses a lot on prevention.
Absolutely, yes. And this is nothing new. A lot of the things are the things that have been around forever: heart disease, obesity, substance abuse, particularly in Northern Kentucky, eating healthy, diabetes. All of these things are nothing new, and there's no new way to solve these things. It's literally by eating better, by exercising, being healthy, a little bit of cognizance. And we too are doing, we work alongside CNE, obviously, very closely. And we too are implementing our community health assessment, which is where we get all the stakeholders and a lot of folks from that are in this room, in fact, come together and decide what the disease burden is in Northern Kentucky. And from that meeting, that's already happened. From that meeting, we established the Community Health Improvement Plan. They're abbreviated the CHA and the CHIP, Community Health Improvement Plan. And that's where we identify the disease burden and then we do something about it. And we come together with collaborators and with agencies to work on these problems. And so we're right in the middle of that. Typically, we have a 5-year plan. COVID, we were unable to meet with folks, and there were different things that were coming out of that. We're starting to, we don't know what we know yet, what's coming out of COVID. So we had a dormant activity essentially for 2 years. So we don't essentially know what the disease burden is. But early things we're starting to see out of that is simple things like missed appointments, kids falling behind on vaccines. And there's a lot of parent guilt in that. There's a lot of mom or dad guilt in that, feeling like, oh my gosh, I've fallen behind. Some of it was unavoidable. I mean, we were literally locked down at that time. So there's no shame in that. We have a big campaign we have for several months of just, and hopefully you've seen the billboards and the commercials and TV and radio. It's just kind of a reminder, top of mind, to get kids vaccinated. Just a slow process of getting back in. Don't forget to get your mammogram. Just general health things that we all put on the back burner. Some of it was just forced. We were unable to do that. But some of these things, perhaps you missed your mammogram, and then the next year, you didn't catch that. And so some of these things we're going to see as it unravels a little bit. So it's really important to be to have these appointments top of mind and get back into the flow of life.
Do we have questions for our health professionals today? I see one from the audience here, Mr. Schroeder. And by the way, Dave, this is an extraordinarily large podium. I'm just going to join the rest of the chorus here. I mean, it's impressive, but it's just, does it adjust? He's been watching this the whole time. Look at that. I like you to be able to see at least 4 buttons. Yes.
Okay. My name is Amanda Peters. I work with the Office of Drug Control Policy. So I have a question about stigma, but I want to give some data first. So this is for people listening, and so for people in the room. I work closely with the health department in St. Elizabeth, so I know some of their strategies, but need some advice on stigma. So in Northern Kentucky, we see an average of a death and overdose every 2.5 days. So we're losing lives every 2.5 days. We also see about 4.4 overdoses every day, non-fatal. In Northern Kentucky, in our region, Boone, Kenton, and Campbell, we have about 10 to 12,000 people every day in active addiction. We have another 9,000 seeking treatment and recovery services here in the 3 counties. We see an increase in our social calls to dispatch, which means mental health, domestic violence. We're seeing increase in our suicide prevention lines. So our biggest barrier to treatment is stigma for mental health and addiction. So my question to everybody listening today and the panelists, what are we doing in our businesses, our workplaces, our circles, our committees, our homes to combat this stigma? Because we have treatment, we have recovery services, we have harm reduction services, we have Narcan, we have all the things that we need, but we can't get to the people who need them.
Dr. Gieske, this is something that the region has dealt with for a long time. Have you or has St. Elizabeth developed a way to respond to that?
Yeah, I can answer that to some extent. I don't know if you want to chime in as well, Roseanne, but one of the main things is getting education out there and really presenting the problem and trying to, as best you can, reduce that stigma, because if you don't reduce the stigma, it's going to be very difficult for folks to come and seek treatment.
Yes, and like Dr. Gieske said, we have a lot of education in the schools. There's going to be a youth summit coming up October 25th of all the area high schools to address this issue among youth. One of the big, I guess, strategies we've used is peer support and people that have been through the disease. And it had great results with our Baby Steps program. So mothers who have substance use disorder that are pregnant and going to deliver, getting them into treatment. We work with peers that have also been through that to get them across that line. It is a challenge. It's something we think about every day. But I think, little by little, working in with all kinds of different partners and people, we can get that out there.
Yeah, let's take it.
Brandon Bray is asking, he says it appears that no vaccination campaign from COVID has had a negative effect on standard vaccinations across the country. What are we doing to get people back to vaccinating?
You had referenced that, Robin. Is there some sort of campaign that the health department is
There
undertaking?
is. We talk about it. We talk about it incessantly. We talk about it everywhere we can. We are obviously affiliated with a lot of agencies and so forth. And like I said, we are doing everything we can to have that message. We realize not everybody's connected to the health department on Facebook, as much as it pains me to say that. Not everyone is engaged or seeking that messaging. So that's why we had to go bigger, and we are being a little bit more top of mind with digital advertising, with billboards and radio and TV, and just providing that education. I think it doesn't occur to a lot of people that so many kids have fallen behind on vaccines. And today I just had a communications call with all of the schools in the district, at least all of the communicators that were on that call. So any way we can reach out and collaborate with anyone, the health department is very eager to have that conversation and call them to the table. We're always happy to collaborate and educate folks, but we did a little bit more of a, we had to go out a little bit bigger in our marketing campaign to get that engagement with a lot of folks that just aren't connected with the health department.